Hello viewers, today I am going to talk about a condition which is extremely common, especially in older females as well as males, which affects thumb. And when you have this condition, it causes a lot of pain and disability because then you're not able to use your thumb for day-to-day activities. And as you know, thumb is one of the most important part of the hand, and it's responsible for almost 80% of the hand functions. So I'm going to today show you a patient who has got base of thumb arthritis, and I'm going to show you how to diagnose it. So this lady presented to me with a lot of pain and difficulty in her doing day-to-day activities. And when you have base of thumb arthritis, patient will complain of pain at base of thumb. So this is the thumb and this is the base of thumb. This is where the small carpal bone meets the metacarpal. And the first thing that you will notice is what we call shouldering. So if you see this here, you see this. So this bump is not normal. When you start, normally it should be flat. If you see my hand, if I show you my hand, it's absolutely flat. But when you start having arthritis, you will see this bump. So this bump is abnormal. So this is what we call shouldering. Shouldering means it starts to look like a shoulder. So in shoulder you have deltoid muscles. So it starts to look like shoulder. So that is the first thing you will notice, shouldering of the base of thumb. So once you have shouldering, you should be thinking base of thumb arthritis. The second thing you will notice is you will start seeing wasting of abductor muscles. So this is, if you see here, I'm not sure whether Prashant can catch on the camera or not, but this abductor pollicis brevis muscle gets wasted, and this also gets wasted in carpal tunnel. And there is a small percentage of patients when you have base of thumb arthritis, they also have associated carpal tunnel. So you should always ask whether they have pins and needles or not. If they have pins and needles in the night, there is association between base of thumb arthritis, carpal tunnel, and occasionally trigger thumb or trigger finger as well. So if the patient is complaining of pain in the thumb and difficulty, if they have shouldering, they have wasting, then you must be thinking of base of thumb arthritis. Now the test I do is, if you press here, she is complaining of a lot of pain. So she winces when I press here. So local tenderness or local pain is the first thing. Secondly, if what we call a grind test. So what we do is try to load it. So again, she is complaining of pain, and I can feel a lot of crepitus. So there is a lot of crepitus. So this is a positive test suggestive of a base of thumb arthritis. So these patients will complain of a lot of pain and difficulty because the thumb is not, they are not able to grip anything. And if you're not able to grip anything, you're not able to do your day-to-day activities, and hence the patient will come with pain and inability to do the day-to-day activities or loss of function of the hand to you. So in terms of X-ray, you can get a normal X-ray, you can get the Robert's view, and if you see here, there's severe degeneration. So there is sclerosis, there is osteophyte formation, and same here, the joint space is completely gone. So this is a classical presentation of base of thumb arthritis. Now I will talk about the management of this condition. Now, as I said before, this condition is extremely common. Now in terms of management, the management is quite tricky because this is one condition. You will see so many patients, they will have arthritis. If you start looking for it, you will see that in your practice, you will find, especially in India and in Caucasian population, you will see there are so many patients who have got base of thumb arthritis. But when you ask them, is there any pain? They will say, no, they don't have any pain. So if they don't have any pain, then you don't do anything for it. Just leave it, because you don't want to treat a condition which is not painful or if it is not affecting their function. So it's a very common thing, but most of the time you will see patients say they don't have any pain and they come for other condition. So if they're not having any pain, just leave them alone. If they have pain in early stages, we give them splints, we give them painkillers, and we modify activities, like instead of using a thin diameter pen, you can use slightly thicker pen so that you don't need that pinch strength. So small modifications like using a thick pen rather than thin pen, using a thick fork, and these activities, they do help their symptoms. But if they are too painful, for me, the best operation in my hands is trapeziectomy, and then you can do FCR, interposition arthroplasty, along with it. So this is my treatment choice. There are conditions in which you fuse them, or in England We used to replace them as well, but the series is extremely limited and the results can be variable. But for a poor patient, if you have one chance, my operation for these patients is excision arthroplasty of trapezium with FCR interposition arthroplasty. If this video is useful, please give us a thumbs up, please do subscribe and do share our channel. Thank you.